Hi, I'm Leanne. I'm a champion with the Work4U program. I'm here to give you some tips for your skin during the lockdown period. So, first of all, you must wash your face twice a day. First thing in the morning, last thing at night. The morning one might not seem as important as you've just washed your face, went to bed and went to sleep, but during the night your face does produce an awful lot of oil. You also produce sweat on your skin, which can clog pores. So just a quick, easy 2-minute cleanse, bit of soap and water. First thing in the morning, give yourself a really good base to start your makeup off on. Never ever sleep with your makeup on. Don't care if your best mate can sleep with it on, and never break out. Everybody's skin's different, and you run an extremely high risk of clogging your pores and causing your acne to be even worse, or even just to have a breakout if you sleep with your makeup on. So step 3 would be your 3-step program for the mornings. So you would like to cleanse with a cleanser with salicylic acid, which is a BHA. It's a wee bit of like a chemical acid on your face, but it's specifically for hydration, and it also has a little bit of antibacterial properties in it. So you can buy these in any Superdrug, any Boots, any chemist. So you're looking for ingredients that either say salicylic acid or a BHA. They can range from anything from £2.49 to £6, and that would do you like over a full month, even when you're cleansing twice a day. If not, there's nothing better than a good old-fashioned soap and water. As long as you follow your toning and your moisturising afterwards, absolutely nothing wrong with soap and water. Your next bet then would be to use an oil-free primer. So again, Boots, Superdrug, anything, NYX, any primer that basically says oil free, and that should give you a good enough base then for the rest to put your makeup on for the rest of the day, and for it not to get like too greasy. But if your skin does, just blot. Even that means a little bit of tissue paper, and you're just dabbing it on your oily areas. Don't rub, because you'll rub your makeup off. You're just pressing it into the skin to get the oil out and onto the tissue paper. Next best bet would be to exfoliate maybe once, twice a week. Don't sit and rub your skin too hard. That's literally, it's just going to pull, and when you get to my age, it's going to cause wrinkles. So no, be gentle. No matter how hard you rub, it will not help with any spots, any clogged pores, any blackheads. Doesn't matter how hard you rub. So lightly exfoliate maybe once or twice a week. Everybody's skin's different, so if you're on the dry side, maybe once a week. If you're on the more oily side, maybe 2-3 times a week, but 2 max. Next couple of random tips just to round this off would be never share your makeup. First way to get cold sores, styes, if anybody's got any other little issues that might not even bug them, but it could be transferred onto your lip or eye products. So best bet is, really sorry, but no, can't have my makeup. But keep your hands clean, and obviously at this time everybody's washing their hands even more anyway, but clean hands, less bacteria onto your face. If you can not touch your face as much as possible, that would even be better, because the more you touch your skin, the more you're going to like transfer any oils from your hands onto your face, onto your makeup. Doesn't really do good. Don't listen to old wives' tales. So people that say, oh, put toothpaste on your spots, or put pseudo-cream on your spots. So don't get me wrong, pseudo-cream is good. It'll take the redness and the angriness out of your spot, but it won't help to dry up. It's a moisturizer, it'll keep it wet. Where when you've got a spot, it's because of a blocked pore, too much oil production. So what you'd want to do is you really want to dry it out. But old wives' tales, don't listen to them. There's plenty of good spot treatments, the little spot pads, any of the like Mario Badescu drying out powder. So that's the little pink clay one that you use so that's the little pink clay one that you dip your earbud in, and then just dab it onto your face and it'll dry it out. Avoid sunbeds, dry out your skin, total UV damage, and you will pay for it in later life. Let's not even just talk about the skin cancer concerns, but any real major issues, like if you think your skin is too bad, too spot prone, you've got any condition like dry patches, redness, flakiness, cracking and bleeding, I've seen that in quite a few people right around here, go see a doctor. You're never annoying a GP professional for issues with your skin. They're there to help. It's your mental health, it's your self-confidence, and if a GP can prescribe you a medical treatment for your skin that'll make you feel better about yourself, it's always going to be a win-win. So you will never be wasting anybody's time if you go and see somebody. Quick fire, couple of minute tip on skin. Stay safe and bye.